Welcome to Virginia Eye Consultants. Since 1963, our mission has been to develop with our colleagues in optometry, ophthalmology, and medicine, enduring patient relationships, providing clinical excellence and state-of-the-art surgical eye care in a world-class facility. We are honored that you have selected us. Your great vision starts at Virginia Eye Consultants.
Hello, my name is Dr. Thomas Joly. I'm an oculoplastic specialist here at Virginia Eye Consultants. I'm going to be talking to you today about Graves' disease. Graves' disease is a condition that affects both the thyroid gland and the tissues of the eye socket. Generally, treatment for this condition is shared by a specialist in the thyroid gland called an endocrinologist and a specialist in the eye problems caused by Graves' disease. Your endocrinologist will order blood tests and medicines in order to treat your thyroid gland. However, treating the thyroid gland alone will not treat the problems associated with the eyes. I'm a specialist in Graves' disease of the eyes, having received training in Vancouver at the International Research and Training Center there for Graves' disease. Both the thyroid problems and the eye problems associated with Graves' disease are caused by your own immune system. When I evaluate you for Graves' disease, I may order lab tests to check specifically for how active your immune system is. This is different from the blood test your endocrinologist might order to check your thyroid gland. I may also recommend treatments that are designed specifically to calm down the immune system, to reduce the inflammation in the tissues of your eye socket. When I first meet a patient with Graves' disease, I take a number of measurements, including a scale of the inflammation of the eye socket tissues, the range of motion of the eyes, the widening of the eyelid opening, and any bulging of the eyes. These measurements will help me determine how severe your condition is and whether your condition is active, meaning that your immune system is causing inflammation at present, or whether your condition is congestive, meaning that the inflammation has happened in the past and the eye tissues are simply showing signs of previous inflammation. If there is active inflammation, I often will recommend anti-inflammatory treatment to calm down the immune system. This is the best way we have of preventing you from having long-term problems from your Graves' disease. The most common form of treatment for inflammation is steroid treatment. Steroid treatment can be given in the form of IV infusions or with pills or with injections into the tissue of the eye socket. Each has its advantages and disadvantages, and if I were recommending this, I would discuss with you what the best option would be for you. A second possibility for anti-inflammatory treatment is radiation treatment. These are a series of painless treatments with radiation similar to getting an X-ray. Oftentimes, patients that respond well to steroid treatment, but for whom the steroid treatment does not last long enough, will benefit from radiation treatment to the eye sockets. This is different from the radioactive iodine that is used to treat the thyroid gland. There are also other immune-suppressing treatments, including a new medication called rituximab, which are used less frequently. Now, typically, the inflammatory phase of Graves' disease lasts 1 to 2 years. I usually will see you on a regular basis during this time, treating the inflammation as much as possible, so that at the end of the inflammatory phase, you are left with minimal long-term effects. If a patient does have long-term effects at the end of the inflammatory phase, then I offer treatment for what is called the congestive phase of the disease. The main treatment to improve the bulging of the eyes from Graves' disease is an orbital decompression. Orbital decompression is a surgery done with the patient under general anesthesia in order to make more room in the eye socket for the swollen tissues. There are very thin bones between the eye socket and the surrounding sinuses, and I can push these bones into the sinuses to make a larger eye socket to fit the swollen tissue and reduce the bulging of the eyes. In some cases, I can also remove some of the thick bone in the outer wall of the eye socket to make more room there. If we were considering this type of surgery, I would discuss with you which exact surgery would be best for you after checking a CT scan of the bones of your eye socket. Often, the swelling of the eye muscles causes the eyes to go out of alignment, and the patient has double vision as a result. Although I cannot bring back the full range of movement that the eye muscles had before they were swollen, I can help to realign the eyes so that you can have single vision when looking straight ahead and while looking down, which gives you the most useful range of single vision. I may need to follow you for a few visits, checking these measurements on multiple occasions before deciding what would be the best surgery for you. The third and final procedure that the patient may need is surgery on the eyelids to improve the coverage of the eyeball. The lower eyelids can be raised with an implant material behind the skin, and the upper lids can be lowered into a position that gives a more normal appearance to the eyes and better protects the eyes. Some patients need all three surgeries: an orbital decompression, an eye straightening surgery, and an eyelid surgery, while other patients need one or another of these various surgeries. Most of all, I want you to know that I am here to give you the best treatment you can have for your Graves' eye disease. I will be working with your endocrinologist to make sure that our treatments are coordinated, and I can tell you that many patients before you have gone through this process and ended up with very good results. However, it can be a process that requires a good deal of patience on your part while we work through the various steps of treatment needed over the next couple of years. I'm dedicated to your care, and I will be here for you.